I'm joined now by Dr. Amol Soin, an interventional pain management physician. And Dr. Soin, it is so good to talk to you today because I know that you're on a mission to help patients get off prescription drugs for chronic pain. So can you talk a little bit about the ways that you're helping patients do just that?
Well, that's exactly right. I mean, trying to get people off of pain medicines, particularly opioids, is a huge thing that we're all trying to do as doctors. And one thing that I learned as a physician is if we could find out what's actually causing the pain or the mechanism of action of that pain and turn that off, a lot of times that's more effective than prescribing medications that just mask the symptoms. And that's what I'm trying to do with my research.
Well, let's talk a little bit more about your research. I know that you've patented and conducted medical trials with several devices, and now you're working on a new use for a well-known drug that could help millions of people. Can you tell us a little bit more about that? It sounds so promising.
Oh, sure. Yeah, so we have a couple of things that we're working on. Medical device-wise, we've developed something called a spinal cord stimulator or nerve stimulator, which is a new way that hasn't been done before to try to treat and block the nerve from firing a pain signal. What we've invented is actually a new type of algorithm or approach to block a nerve using neurostimulation. And then the second thing is we're working on some pills, some medications, and one in particular, a drug called naltrexone, we've discovered in very low doses with the unique formulation that we've come up with in the lab, it can provide a lot of relief with people that suffer from chronic pain. And the advantage of that is that this pill is not addicting and it's not sedating, and it really works on treating the mechanism of action of some of the pains. And so that's very promising for the millions of pain sufferers out there.
Wow. What is, Dr. Soin, the most common misconception among patients that are in chronic pain?
You know, there's a couple. First of all, the ones that are suffering from chronic pain may feel a sense of hopelessness. And that it's important to know that there are treatment options out there, particularly from interventional pain management specialists that may be able to help you. The second is the whole concern about opioids or narcotics. There are a lot of other ways to treat pain than addicting painkillers. And it just takes time and effort to find out what's actually causing your pain and treat that cause as opposed to masking your symptoms, I think could be better in the long run.
Now, I know you're also the president of the International Pain Society, and it seems that many patients don't even know that you're a resource. Can you maybe give us an example of someone that you were able to take off prescription drugs and cure their pain and kind of how they're doing now?
Oh, sure. You know, it's what I do for a living every day, try to treat people and manage their pain without addicting painkillers. But, you know, a lot of stories, you know, I got to tell you one. I had this patient who was actually a reverend, a preacher, and he used to tell me that he could never stand up and give a sermon because of debilitating back pain. And at times, if he had to speak for an hour, within 20 minutes, he'd have to lean over his podium just to get some relief. And eventually he started doing it sitting down. So we looked at him and he'd been trying all sorts of things, and we discovered that one of his nerves was pinched in his back. And we did a procedure called a minimally invasive lumbar decompression to take pressure off of his spinal stenosis or narrowing of the spine. And within a week, he told me he was able to stand up and give his entire sermon. And he's been doing great since. And so that's just an example of trying to diagnose the actual problem and then treating that specific disease state. And oftentimes you can get relief by doing that.
Wow, I feel like there are probably so many of our viewers right now that are watching that are in chronic pain and saying, oh my goodness, there are other ways that I can help myself feel better. So how can our viewers find out more information and connect with you?
Well, I think one of the best things to do is to find an interventional pain management specialist near you. And you mentioned that I'm president of this American Society of Interventional Pain Physicians. We have a website that's asipp.org, asip.org. And on there's a physician finder icon. And you can literally find a physician in any part of the country by doing that. Or you could just Google interventional pain management specialist in your area and hopefully find a resource for you.
Well, and we just provided the resource for people to get in touch with you. Dr. Soin, thank you so much for joining us today. And thanks for all of the great work and research that you're doing to help everyone live a more pain-free life.
Thank you so much.
All right.